Yeah, that is one pernicious case of brain rot if I've ever seen one. I hate to tell you this, but you got a serious case of brain rot, my friend. I'm gonna check your other ear here and just see what's going on. But yeah. So basically what we're looking at here is he got mayonnaise for brains at this point. But we can help you out today. We can go ahead and clean out all of that brain rot you got going on. I'm just gonna inspect these ears real quick because I want to see if it's starting to infect anything on the outside here. So just bear with me. Okay, I'm just going to use my little acupressure tool here to just poke around the outside of your ear a little bit. You let me know if there's any pain. I'm just looking for any sensitive spots. Make sure that brain rot isn't starting to, get outside that skull of yours. Good. Let's check over here on this side, alright? Good. Well, doesn't look like the infection spread too much, but yeah, you definitely rotted. So I'm gonna take another look inside. Just want to see if I can see how deep this brain rot actually goes. But I think we got a case of through and through here, so yeah, we're definitely gonna have to get that cleaned out for you. Alright, same thing over here. Yeah. I mean, this is just sludge at this point. Do you even touch grass, or do you just sit at home and just scroll? That's alright, don't worry about it. Alright, my friend, so I'm going to do a little test in your ear, just a little tympanic membrane test, just to see if that's got any sensitivity left in it. So just bear with me. Just going to slip the otoscope inside again, and 1, 2, 3. Very little reaction. And again, 1, 2, 3. Yep, and I'm going to say that your tympanic membrane is dull. Very dull and non-responsive. Alright, so we're going to do a little hearing test real quick. I want you to close those eyes, and you just repeat the word back to me that you hear, okay? Alright. Sleep. Relax. Brain rot. Scroll junkie. Dopamine chaser. Okay. All right. Very good. I want you to keep those eyes closed for me, and I want you to just tell me which side of your head you feel me touch your ear, okay? All right, ready? And... Good. Yeah. Okay, good. At least the ear sensitivity is still there on the outside, but let's get to cleaning out that brain rot. If you'd like, you can just close your eyes for the remainder of this exam until I need you to pay attention again. But in the meantime, use my handy-dandy light pick and my fluffy brush and pick to just come in and start cleaning out these ears, alright? So you just relax. pain or discomfort at any point in time. Okay, hold on. Gonna go in with our fine point tweezers, and we're just going to pull out this big old long gross thing of rot. Ooh, gross. Alright. Let's go back in, shall we? We're just trying to scrape out all that junk. You really should get outside more. Touch some grass. Read a book. Get off the internet. It's bad for your brain. Also, stop wearing your headphones for very long periods of time. Just getting earwax jammed in there, so I gotta get that out before I can really even get to some of the rot. Got a tiny little detail brush here, see if we can go in there and just kind of brush out some of that wax on the edge here. You're gonna be okay. Just gonna pick out a couple of things. Okay. Let's let that ear rest a little bit, and let's work on the other side here. So let's just come over here. We're just gonna do the same thing. Just relax for me. Okay. You're gonna be alright here. I'm gonna have you come in for at least a monthly ear cleaning. We're gonna have to stay on top and maintain this for a while. Let's go in with that detail brush. Now we got some of that stuff loosened up, we could just pick out the little bits. Just clear out all that rot, all that junk, all that gunk. Okay. Alright, so we're gonna just try to relax those ears. We're just gonna brush them down a little bit. Just relax. Alright, so I'm going to get a little deeper into your ear with this tiny, tiny little brush. And we're just going to use a little of my special brain rot solvent on the tip to kind of just really loosen up everything. So just going to get that all nice and saturated, and you just relax, keep those eyes closed for me. We're just going to get real deep in there. Basically, oh, look at what you did to this brush. Yeesh. Luckily we have more. Just go back inside there. Gonna have to use my scraper to kind of cut through some of this stuff, so just bear with me. This will not hurt at all. Okay. Alright, my friend, I'm going to get a little bit deeper now. Use my otoscope. We're just going to place this right in the ear canal. I'm going to take my brush. We're going to go down through the otoscope here. Okay. What's that? It's going to make it a lot deeper in there. Get on really deep stuff. It just goes right out. Great. Okay. Let's let that ear rest a little bit. And let's get over to that other side. Same thing. We're just gonna get in there and scrape out anything that shouldn't be there. Yeah. Let's get any stubborn stuff here. Okay. And same thing as the other side. We're going to go back a little bit deeper again. So you just relax. I'm just going to again put my otoscope inside your ear here. And take a look inside of that one. Just bear with me a second here. Much better. Little irritation I'm seeing, so we're gonna brush some of that with some nice numbing solution so that you don't feel any pain there. Take a look at the other side. Yeah, okay, nice and clean now, which is great. Let's just calm down some of this irritation from the cleaning. Hey, when your brain rot's that bad, you're bound to be a little bit sore. So I'm going to take this really nice big fluffy brush here. We're just going to go in and just gently brush down the sides of that ear canal. Okay, good. Good. Same thing on this side. I'm going to do a quick hearing test on you. Make sure that everything is working properly. So, I'd like you to just close those eyes for me. Same thing as before, just repeat the word back to me, okay? Sleep. Good. Dream. Vacation. Coconut. Good. Now I'm going to do it with a noise going off in your ear, okay? So same thing. Word recognition while I distract your other ear, okay? Here we go. Pokemon. Good. Charizard. Good. Umbreon. Good. Flareon. Good. Jolteon. Good. Alrighty, so that's good. And I want you to keep those eyes closed. Sensation time. Just let me know what ear you feel me touch, right? Alright, here we go. Correct. Good. Yep. Good. Alright, if you'd like, you can keep your eyes closed. We're just gonna end today's exam with a gentle ear massage just to make sure that blood is flowing and everything is feeling nice, relaxed, and clean. Just keep massaging that ear a little bit. I want to make sure that, again, a good amount of blood flow is going to it. Same thing over here, just going to massage the ear. Okay. Good. Good. Just going to this, you can absolutely book an appointment for our sleep ear cleaning treatment. It is a very therapeutic ear cleaning and sleep massage plus sleep study. So we give you the ultimate bit of relaxation and give you info on how you sleep at night. So maybe something you consider. You can always make sure that you check off our notification so that you don't miss an appointment window. That your brain rot is all cleaned out, my friend. So, I'd like you to just go relax, hydrate, and make sure you get plenty of sleep tonight, okay? Alright, so again, don't forget to make an appointment. And we'll see you again soon. Okay, here, well, let's see. Well, you definitely hit your head kind of hard there, but we're going to do a bit of a cranial nerve exam on you just to make sure everything's still working, alright? Otherwise, how you feeling? I know. Knock to the head is never any fun. But let me just keep looking at you and make sure I'm not seeing any other injuries here. How did you do this anyway? Oh, hey. Stairs can be a nightmare. I have fallen up and down plenty of them in my time. Alrighty. Well, my friend, we're just going to give you a look-see over our rate to make sure that you're all good. Send you with some anti-inflammatories for that lump on the skull there, and hopefully we'll get you out of here relatively quick. So I want you to just look straight at me. I'm just going to go look at your temples real quick. I'm just going to press, press, press. You let me know if you feel any pain. Ready? Press, press, press. Any pain? Good. Press, press, press. Any pain? Good. Now when I press down your nose right here, let me know if there's any pain. Any pain? Good. Palpate under your sinuses. Right under the eye. Any pain? Okay, good. Good. Alright, I'm now feeling around your jaw, so just sit still for me. Good. Good. Go ahead and clench real hard. Good. Go ah. Good. Smile. Good. Frown. Good. Good, 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 good. Raise your eyebrows 3 times. Good. Raise them once. Twice. Good. Good. Alright, I'm gonna just hold your throat real quick. Go ahead and swallow for me. Good. Okay. I don't know where I put my light. Alright, just should I say go ah. Just want to take a look inside. Okay. No tongue depressor not needed right now. Everything's good. UV looks good. Okay. Alright, very good. We're just gonna look at some facial muscles here. So you already did a little frown smile test. I want you to puff those cheeks out. I'm gonna try to pop them, alright? So just puff them out, ready, and pop, pop, pop. Good, one more time. Pop, pop, pop. Very good. Alright, so now I want you to shrug your shoulders up and don't let me push them down, okay? And ready? 1, 2, 3. Don't let me push them down. Good. Don't let me push them down. Good. Don't let me push them down. Good. Alright, same thing with the face. Gonna test your neck muscles here. Put my hand on the side of your face. I'm gonna try to push. Don't let me push it. Ready? 1, 2, 3. Push, push, push. Good. Other side. 1, 2, 3. Push, push, push. Good. Alright, I want you to hold your hands up for me like this. Follow along with my fingers. Good. Alright. Good. 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 Alright. So I think things are looking okay. Not seeing any signs that I should be worried about quite yet. How's your nose? Did you hit that on the way down? No? Okay, good. Any sense of, smell loss? Can you smell the sterile stuff in the hospital? Good. How about taste? Okay. You bit your tongue, you tasted blood. Okay, I get it. It's all good. Alright. I'm just going to sanitize my hands real quick. And we're going to move on to the eye exam portion of the cranial nerve exam today. Pretty easy. Really, if you fail it, don't worry about it. Alright, so what I want you to do, look straight at me and just follow this light with your eye. Good. Just follow the light. Good. Good. Alright, now follow the light, not the finger. Light, not the finger. Good. Good. Very good. Okay. Look straight at me. Let me know when you can see the light come in. Go out. Okay. Good. In. Good. 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 we do a little pupillary response test. I'm going to hold up my eye blocker here. We're going to swing the light in, out, get that dilation and contraction of the pupil. Good. In, out, good. Alrighty, and on this side, in, out, in, out, in, out, in, out, in, out. Very good. Not seen any issues so far. I like to test your peripheral, so kind of like the light. Look at my fingers, let me know when you can see them come in and go out, okay? Alright, ready? And good. Good. Very good. Good. Okay. I want you to look at my hand and let me know how many fingers I'm holding up, okay? Ready? Good. Very good. All right. Pass that one. And grab my ophthalmoscope here. And take a look in your eye. The light won't be too bright. Don't worry about it. See? No problems. So I'm going to get right close, kind of forehead to forehead. You just open your eye. And follow my instructions, please. Go ahead and look up. Good. And down. Good. Just looking for signs of like copper wiring, things like that. Damage to the nerve here. Okay. To the left. Right. Up and to the left. And down to the right. Good. Alright, other eye. Here we go. Same thing. Go and look up for me. Good. Down. Good. Left. Good. Down to the left. Down to the right. Good. Good. Ocular nerve seems to be intact. I'm not seeing any problems there. Alright, so everything's looking good on the eyes so far. Just want to make sure that everything's still good. So I'm going to do this. I'm going to point to a letter. Read it. Okay? See this one? Good. That. Good. 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 Can you read this line? Good. And read this line. Good. No problems with that. One more little test, a little color recognition. Just make sure you're not going colorblind. Alright, so I'm going to hold up a film in front of your face, shine a light through it. You let me know what color it is, okay? Alright, here we go. And yellow, good. Here we go. Red, very good. Pink, very good. Purple, good. Blue, good. The last one. Teal, green. Yeah, we're not gonna be nitpicker about that one. Very good. Teal or green, we're not going to be a stickler on that. Alrighty, so eyes are looking good. Let's move on to those ears. I'm going to grab my otoscope attachment real quick. So we take a little peek inside. on. If you'd like, you can close those eyes. I'm just gonna come over here and take a look inside that ear real quick. Okay. That was the last time you had your ears cleaned. You might be due for another. Okay. Let me take a look at the other side here. Yeah, maybe schedule a follow-up appointment with us to get those cleaned out, okay? Yeah, it's not a problem. No worries on that. Alright, so looks pretty good in there. We're gonna do some hearing tests. I'm gonna do a little tympanic membrane test. I'm just gonna slip the otoscope in your ear. This little bulb is gonna push some air into your ear against your tympanic membrane. No pain. Just gonna let me see how it reacts and see, make sure it's working. So just hold still for me. Alright, 1, 2, 3. Good. One more time. 1, 2, 3. Good. And one more time. 1, 2, 3. Good. Other side. Alright, here we go. 1, 2, 3. Good. 1, 2, 3. Good. And 1, 2, 3. Good. Very good. Not seeing any issues in the ears. I'm going to do a hearing test on you though. So I'm going to have you close those eyes. Repeat the word you hear back to me, okay? Alright, here we go. Sleep. Okay. Dream. Good. Flareon. Good. Jolteon. Espeon. Umbreon. Sylveon. Glaceon. Leafeon. Eevee. Alright, very good, very good. I'm going to have you keep your eyes close for me, and I'm going to make a sound in one of your ears. Just let me know which ear you hear it, okay? Alright, here we go. Just close those eyes for me, alright? Alright, here we go, and good. 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 I get you there. Good. Good. Alright, well, there's no fooling you. Okay, so now I want you to do some sound identification for me. I'm either going to use the bristles, or I'm going to use my crinkly pen, and I want you to let me know which one it is, okay? So you're going to close those eyes for me, and let me know what you hear. Pen, brush, pen, brush, pen, brush, good, pen, brush, good. Keep those eyes closed for me. Keep them closed. Alright, so we're going to continue on with the sensation test that we just started. I'm going to have you close your eyes. Let me know where you can feel the puff of hair on your face or your neck, okay? Alright, keep those eyes closed for me, and good. Good. Very good. Yeah. Great. Good. Now keep those eyes closed for me. And I want you to tell me now if it's the soft or the dull object, okay? Alright, here we go. Soft, good. Dull. Soft, good. Dull. Soft, good. Dull. 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 Very good. Soft. Soft. Good. And soft. Very good. Dull. Dull. Soft. Good. Keep those eyes closed. Now I want you to tell me if you can differentiate between metal, which you felt, and wood. Okay, here we go. Keep those eyes closed, closed, closed for me. And wood, metal, wood, wood, metal, metal. Good. Wood. Metal, wood, metal, wood, wood, metal. Very good. Keep those eyes closed, please. And for the last portion of the sensation test, actually, I should say like third to last, it's going to be, do you feel a single point or 2 points? Okay, ready? And 1, good. 2, 2, 2, 1, 1, 2, good. 1, 2, yeah. 2, 1. Very good. All right, my friend. Well, go ahead and you can open those eyes. Gotta say, outside that knock on your head, I'm gonna give you a clean bill of health. I need you to go home, put a ice pack on that head. We're gonna get you some anti-inflammatories. They'll be at the front desk for you on the way out. I'll give you a couple ice packs you can use on your way home. But when you get home, gonna use ice on and off, 15 minutes on, 15 minutes off. Do that until the swelling subsides. Make sure you hydrate a lot. Grab some, sports drink, electrolytes. Just stay hydrated today, and please, please get a good night's sleep. But if you're feeling any kind of sick, call us. We're more than happy to make a house visit. All right? All right, well, you go home. You feel better, and we'll see you again soon. Well, welcome back, Explorer. Looks like the computer flagged you for a little contamination from your little exploration down on the planet, so why don't we take a look at you and see what's going on, all right? Computer, can you scan the patient, please? Oh, okay. Well, computer says you have a case of a tingle mite, so just stand still for me. I'm just going to give you a quick scan. There it is. Right there on the ears. Yep. Alright, so don't worry about this. Tingle mites are very harmless. They just kind of crawl in your ear and they extend these little tentacles. And what they do is they wrap around the tingle receptors inside your head and they feed off the tingles. So you don't get the tingles, they get the tingles. Again, you can live with them if you'd like, but that's a life without tingles and that sucks. So I'm gonna just take a look real quick at your ears just to see. Yeah, we got like a purpley blue one over here. Yeah, look, it's tentacles already coming out of your ears. So what we're gonna do is we're gonna snip those today, do a very thorough removal, and get these all cleaned out for you. Yeah. These are coming out so much that it's like covering your entire ear. Wow. I don't think I've ever seen a case of the tingle mites this bad, but alright, I'm gonna take a look inside your ear. I want to see how deep they've gotten. So just I'm gonna grab my little otoscope here. We're just hold on. It's gonna have to. Yeah, we're gonna have to move some of these little tentacles aside here. So just bear with me. that ear is pretty contaminated. So is this one. Wow. Okay, let me just hold on for me. Oh wow. Okay. All right. So we definitely got our work cut out for us today. I'm gonna use my scanner again and just see how deep these go. Because if they go through and through, we're gonna have to do a full cleanse of your brain, but I don't think, I don't think we'll have to go that hard. So what we're gonna do is I'm going to use my tweezers and we're going to pull the tentacle away from the ear and we're going to snip it, okay? It's not gonna hurt. You let me know if you feel any pain, but for the most part, I want you to just close those eyes. Let me get rid of those tangle mites, and you just relax and let me know when you can start feeling those tangles again, okay? Alright, so we're gonna start off over here, and we're gonna start on the outside of the ear. Take that and just like that. Just gonna snip those away. This one's a little closer to your ear, so I'm gonna use some safety style scissors so that we don't accidentally nick that ear. So then you let me know if you feel any discomfort. Oh, look at that one. Pain or anything like that. Oh wow, this one really. Oh look, I think we got a piece of the body. See that right there? See that? That's a piece of the body. So we're gonna see if we can just. Oh yeah. See, all that was just right in your ear. We're actually gonna hold on to this one as a specimen. We've been studying them since we first got to orbit around this potential colony planet, and well, you know, we use ASMR for our explorers to help keep them calm, and we noticed that the efficacy was dropping, and that's how we found out about the tingle mites. Well, that and the tentacles hanging out of people's ears, but. Alright, this one looks like it's trying to retract a little bit, so we're gonna let that be. We're gonna go onto the other side here, and we're just gonna do the same thing. This one's pink. That's actually kind of a new species, I think. I wonder. Do me a favor. Where did I put it? Alright, just look straight ahead of me real quick. Let me know if you feel any tingles from following the light. Just follow the light. Good. Good. Any kind of tingles. Okay. Let's try this. I'm just going to just do a little visual triggers. See if there's any from that. No. Alright, well, I think Mr. Pinky here is getting those visual trigger tingles from you. So let's see if we can get this one. Alrighty, you just relax. Oh, this one is just, look at that. Big old chunk. Don't worry. We're gonna get these ears all cleaned out for you. And you'll be feeling right as rain. Okay. I'm gonna go in with my little laser zap real quick. You just hold still for me. I'm gonna see if I can try and irritate the little guy. Get him to pop out. So you might hear a slight sound. And around the okay. Yep, there's still a lot of tentacles here. Alright, come on, little buddy. Alright. Same thing over here. Just gonna try to zap him a little bit. Just want to make it a little frustrated and not want to live inside your ear. Alright. We're gonna have to get a little bit deeper now. So just relax for me, please. And we're going to keep snipping these little buggers away. This pink one, though, is being extra stubborn, but I just got a piece of its body, so let's see how much we can pull out at once. Sometimes those tentacle bits just go flying everywhere. That's okay. Alright. Just relax for me here. Some of these tentacles are very wrapped up around your ear here. And if we're not careful, we'll miss one and it'll just start regrowing. And when that happens, well, because it's just a little piece, it has a chance to bury deep in your ear. And when that happens, well, much harder to extract. See if I can get this piece of the body here. Stubborn little guy. Alright. Oh, great, behind your ear here. Great. Some of these can be very hard to get. But you're in good hands. Haven't lost a patient on this mission yet. Well, except for Fred, but listen. You shouldn't eat weird fungus on an alien planet. That wasn't my fault. That was all Fred. It's alright though. Alright, I have the majority of this one extracted, but the body is still left. So I am going to let that sit for a minute, and we'll just work on this one over here, and then we'll go and get that last bit out for you. Look at that. This one is holding on for dear life, but it's on its last leg, so we're gonna just ease the tension on those tentacles a little bit. Just stretch them out. Get them all kind of loosey-goosey, and then we're gonna sounds like a solar storm coming through. We'll get you out of here in time. Right there. Let me just check. There's a few little pieces that are hanging on, so just give me a minute. Yeah, this one's buried down the crevice here. right behind your ear, and it looks like it's trying to bury its way back in too. So just bear with me. There we go. And oh yeah, one more. Almost got it. There we go. Alright, let me just oh, we missed one. Hold on. Can't let any piece remain. Let me just look at your ear real quick. I think there might be a few stragglers, so we're just gonna pick out these little bits here. Doing okay? Yeah, that's fine. And one more bit here. Good. Alright, we're gonna let that ear relax. We're definitely going to go back in and clean that out a bit, but let's get the rest of this little guy over here gone, okay? His body's sticking out, so we're just gonna grab that. Same thing. Stuck. Look at that. It's alright. Again, we'll just stretch it out. Get all loosey-goosey. And then we will just snip and watch it want to fall apart. And then we're just gonna go back in. Oh yeah, there's still one more piece here. See? No biggie. And let's just check the little bits left over. Yeah, a little bit. It's okay. It's alright. Okay. Alright, so we got those little buggers all cleared out. I'm going to take a look inside those ears again, so just bear with me one sec. Alright, nice and clean. Well, clean of tingle mites. We have to go in there and clean out their residue, so that's going to be alright though. Same thing. Yep. Alright, so now we have the fun part. Super relaxing. I'm just going to go in and I'm basically going to just clean out all that residue, basically what they, little bits of tingles that they didn't digest. So we'll just go in there, we'll clean it out, and we'll do a few hearing tests and we'll get you on your way, alright? Great. So we're going to go in there with our very fine detailed brush and we're just going to put that in the canal. There we go. This long, fluffy one. This really catches any very fine, small pieces. I'm going to go a little bit deeper, so what I'm going to do is just take my otoscope here and we're going to stick the brush right down there so that I can get it nice and deep in your ears and you just relax. Give that ear a little bit of a breather. And we're going to go and work on the other side. same thing back in with the otoscope. So just relax for me. Hey, at least it's not those ones that, bury in your guts. Alright, so you just relax. We're going to do a little peek inside your ears again and a little tympanic membrane test to make sure that there's been no damage done. Which I highly doubt, but, you gotta make sure, so just bear with me. Good, looks a lot cleaner, just a little bit more. Alright, so now we're going to do a little tympanic membrane test. I take my little bulb, blow a little air, see how it reacts, okay? So I'm just going to feel a little bit of a puff, alright? No pain, just a good, good, good. Same thing on the other side. Let's take a peek inside first. Much cleaner, a little bit more, but good. Alright, same thing, tympanic membrane test, ready? 1, 2, 3. Good. 1, 2, 3. Good. 1, 2, 3. Good. Alright. So functionally, no damage to the ears, which is great. Got a little more cleaning to do. Nothing too crazy. We just have a little more of the residue left. So we're going to take these very fine brushes and we're just going to go, because most of it's on the outside of the ear now, so I'm just going to clean that up for you. One more look inside that ear. Just hold still. Okay. Alright, good. Let's do one little last clean out on this side. Do a couple hearing tests and we'll get you on your way, alright? You've done it real well today. We're going to do a little hearing test on you. So I'm going to have you close those eyes. You let me know what word you hear in your ear, okay? Alright. Space. Good. Dream. Okay. Vacation. Good. Arceus. Good. same thing, but I want you to let me know what ear you hear a sound in, okay? Alright, you ready? Alright, close those eyes for me, and good. Very good, okay. And before we give you a clean bill of health, one more test. Just want to make sure that there's no residual pain or tenderness. So I'm just going to gently massage your ears. Again, you just let me know if there's any pain or tenderness. I'm not seeing any signs of any residual issues from those tingle mites. So I think you're probably going to be in the clear, my friend. You're probably going to be in. But make sure you proper safety protocol on your next excursion, and you'll be able to avoid another infection of tingle bites. But in the meantime, your tingle receptor should be good to go. So I want you to go back to your bunk, watch some of the mission-approved ASMR videos, and get a good night's sleep, because you got another mission tomorrow. Alright? I don't really want to see you back in sickbay, but you know where to find me if you need me. See you soon. Hey there, I'm Dr. Tingle. I see we have you in for a cranial nerve exam today. So why don't you go ahead, have a seat, and I want you just to look straight ahead. If you'd like, you can close those eyes. I'm just going to come up and get a look at your scalp real quick. Just looking for any signs of injury, lumps, bumps, contusions, bruises, or anything that really shouldn't be there. If you hit your head recently by chance, feel any pain while I'm exploring up here? Okay, good. You keep your eyes closed if you like. I'm just going to come up and take a look at your forehead. Just look for any signs of swelling. Good. I'm going to palpate your temples. I'm just going to press gently. Any pain when I do that? Okay, good. Alright. Just going to palpate down your nose from your T-zone. So just let me know if you feel any pain or discomfort. Good. Okay, and I'm gonna just kind of palpate under your eyes there. Just feeling for any pressure or swelling in those sinuses. Good. Okay, keep your head straight. Just take a look at those cheeks. Sure, I'm not seeing any kind of signs of rosacea or vitamin deficiency. Good. Okay, I'm going to take a quick look. Just do a quick inspection of your ears here. Just make sure I'm not seeing anything. Shouldn't be there. We'll do a little bit of a deeper inspection later on in the exam. So, let me take a look at this one over here. Okay, good. Any pain? Very good. Alrighty, just keep that head straight at me. I'm just going to feel down under your jaw here. So you just let me know if there's any pain, discomfort. I know it's a little windy out there today. Good. I'm just going to palpate right behind your jawbone there. Just go ahead and clench your jaw for me real tight. Good. Bite down one more time. Good. Okay, I'm just going to feel around your neck. Just make sure I'm not feeling any kind of lumps that shouldn't be there. Okay, just going to palpate gently. Good. Just go ahead and swallow for me. Good. All right, just going to test your jaw muscles real quick. So I want you to give me a big old smile. Good. Now puff your cheeks out. Good. Keep those popped. Don't let me pop them. 1, 2, 3. Pop, pop, pop. Good. Give me a big frown. Good. Raise your eyebrows. Wonderful. All right. So those facial muscles look like they're doing A-okay. So we're going to start today's cranial nerve exam with your smell and taste test, since they are the easiest and the quickest. Have you ever had one of these tests before? All right. It's going to be very simple. I'm going to have you close those eyes. And I'm going to spritz something in the air, have you smell it, and you let me know what it is, okay? All right. So again, I want you close those eyes. And we're just going to give it a little bit of a spritz here. What do you smell? Lemon. Very good. Very good. All right, let's try this one. What do you smell? Lavender. Very, very good. All right, keep those eyes closed for me. Stick out your tongue. And we're just going to put a little drop of this on there. 1, 2, 3. What do you taste? Coffee. Very good. All right, one more. Keep that tongue out. And 1, 2, 3. What do you taste? Lemon. Very, very good. All right, so smell and taste are looking A-okay. But while we are focused up here real quick, we're just going to take a few measurements of that face and skull over here. So we're going to start with the eye measurement real quick. Just going to get you centered there. All right, good. Space between the eyes is normal. All right, we're going to do that nose real quick, so just bear with me real quick. Okay. Do the entire length of your face, so just stay still. Okay, good. And the width of your head here. Let's take that one again, just one more time. Okay, good. And to the distance of the corner of your eye, to the corner of your mouth. Good. All right, other side. All right, good. Symmetry is right where we want to see it. All right, so we're going to move on to testing your eyes real quick. Have you had any issues with your vision in the last 3 to 6 months? No? Oh, gloves make noise sometimes. Good. Alrighty, so we're going to start with something very easy. This is just a simple follow the light. So I'm just going to have you look straight ahead, both eyes, keep that head still, and just follow this light for me. Good. Just looking for any abnormalities or lagging responses. Alright, so I'm going to have you close one eye now, and we're going to do the same thing. Just follow that light for me. Good. Follow that light. Good. Good. Alright, let's do the other eye now. I'm just going to cover that and good. Alright, that's looking pretty good. We're going to do a pupillary response test now. Same thing, I'm going to cover one eye, I'm going to take the light, swing it in, swing it out, looking to see how your pupil dilates and contracts. So you just hold still for me, and we're going to go in and swing in, out, in, out, in, out, in, out, in, out. Great. All right. And here we go again. In, out, in, out, in, out, in, out, in, out. Wonderful. Not seeing any problems with the eyes so far. I do want you to do a little peripheral vision test. So what we're going to do, I'm going to have you look straight ahead, and you let me know when you see the light come into view and out of view. In and out. All right. All right, here we go. And good. 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 All right, other side. And good. 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 All right, and keep looking straight ahead. Good. 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 Okay, and good. Mm-hmm. Great. So far, so good. I'm just going to grab my ophthalmoscope here, and we're going to take a look inside those eyes of yours. Just going to turn that on. So I'm going to get really, really close. I just need you to look straight ahead and follow my instructions, please. Alright, so I'm going to have you look up for me, please. Alright, I'm just looking for any signs of copper wiring or any kind of damage to the optical nerve here. Alright, look to your left, please. And to your right. Down. Up to the left. Good. Up to the right. Down to the left. Down to the right. Good. Let's check out that other eye. Same thing, same thing. So just good so far. Alright, go ahead and look up. Okay, look down. To the left. Good. And to the right. Up to the left. Down to the right. Up to the right. And down to the left. Alrighty. Everything looks good inside. You'll hear no complaints from me. We're going to do a little eye chart here. I'm sure you're familiar with these. Just want you to read off what the letter I point to, okay? Start real easy. Good. Oh, good. O. D. J. B. Good. S. P. H. All the way down here. Can you read this? T. F. M. B. H. Great job. 2020. And one more last test on those eyes. We're going to do a little color blindness test on you. So these are the classic Ishihara plates. I'm going to have you look at this control board real quick. Tell me what you see. 12, very good. Alrighty. Do a little green-red test. What do you see? 8. Very good. Alrighty. Let's try this one. What do you got? 5. Very good, very good. I have the little green blue. 2, yeah. 6, yeah. Good. Alright. And this one. 5, and this one. 7. Very good. Alright. That one. 26, good, and 42. He also would have accepted the answer to life, the universe, and everything, but great job. You passed 100%. Alrighty. So now it looks like those eyeballs are perfectly fine. We're going to move on to taking a look at your ears. Alright, so for this portion of the exam, if you like, you can keep your eyes closed. Closed, closed. I'm just going to come over here and take a look at your ears. Just want to make sure that everything is looking good. There's no signs of damage. Just going to squeeze around the outside of your ear real quick. Nothing hard. Just want to make sure that everything feels okay. Any pain while I'm working on your ears here. Okay. And let's take a look at this side over here. Any pain or discomfort? Alright, good. I want to make sure that those ears are a-okay. Alright, so I'm going to take a look inside. Just going to grab my otoscope attachment here. And we'll take a look inside those ears of yours. Sure that's on. Alright, so you just hold still for me. We're going to take a look. Take a look inside real quick. Okay, alright, yep, definitely have some wax buildup in here. Okay, yeah, we're going to have to take care of that. So we got the other side here. Yeah, same thing, quite a bit of wax buildup in there. Alright. Where is my... here we go. So we're going to do a little tympanic membrane test on you. I want to see how well it's functioning right now. So you definitely have some earwax buildup. We're going to get rid of that for you today. But here on my otoscope, I have a little air bulb here. Stick it inside your ear. Blow a little air. See how your tympanic membrane reacts, okay? Alright, so just relax. You can close your eyes if you'd like. I'm just going to come in, take a look, and 1, 2, 3. Alright, one more time. 1, 2, 3. Okay. And other side. Same thing. 1, 2, 3. 1, 2, 3. Okay. Yeah, we're going to clean those ears out real quick. So just let me grab a couple tools and we'll get to getting that wax out, and then we'll do some hearing tests on you, make sure that everything's all right. All right, so I have my little light pick here that'll let me help see inside your ear while we pick it out. And we have our little fluffy brush and pick to help us sweep out any of that earwax debris that comes out. So if you like, you can close those eyes, and we're just gonna get in there and clean out that earwax. So just relax for me. Let me know if this causes you any discomfort at any point in time, okay? I'm gonna just take a look inside real quick. See how we're doing, how you feeling? Alright, so just bear with me. Alright, I'm looking a little bit better. A little bit more to go. It's gonna be A-okay, my friends. Let's get the rest of that out of there for you. Alrighty. Take another look inside real quick. And let's see. Much better. Alright, let's give that ear a break. And let's go after the other side here. Just gonna do the same thing. Look inside again real quick. Let's see what we're working with here. Okay, looks pretty good. Just got a little bit more. Just a little bit more. Alright. Let's just pick. I'm going to take one. Let's look inside. Alrighty, good. Much cleaner. Alright, let's do one more tympanic membrane test just to make sure everything's working. And we'll move on to your hearing test. Okay. Alright, bear with me. 1, 2, 3. Good. 1, 2, 3. Good. And one more. 1, 2, 3. Good. Alright, other side. Here we go. 1, 2, 3. Good. 1, 2, 3. Good. 1, 2, 3. Good. Alright, well, those ears are all cleaned out. Why don't we move on to some hearing tests? I'm going to have you close your eyes. I'm going to whisper a word in your ear, and you're going to tell me what it is, okay? All right, so keep those eyes closed for me. Relax. Good. Sleep. Dream. Chocolate. Good. Coconut. Good. Squirtle. Very good. Dratini. Okay. Chimchar. Very good. Fuecoco. Wonderful. Alright, so now I'm going to have you keep those eyes closed. And I want you to tell me which ear you can hear the sound at. You just raise a finger, okay? Alright, and here we go. Good. Good. Very good. Good. Very good. And now I want you to tell me which ear you feel me touch. Alright? Good. Good. Very good. Very windy tonight. Good. Both very good. Alright, you can open your eyes just for a moment. We are going to do one last part of this exam, which is a sensation test. So I'm going to have you close those eyes again, and I'm going to touch you with either a dull object. As you can see, this pointer has a little metal ball. Very dull, will not hurt. Or a soft object. And you're going to tell me which it is. Alright, so I'm going to have you close those eyes. And dull, very good. Soft, very good. Dull again. Soft, dull, good. Soft again, good. Alright, we're going to switch it up a little bit. We're going to do sharp and dull. And yes, this is a little prickly, but it will not break the skin, okay? So just keep those eyes closed for me. And here we go. Good. Good, dull. Sharp. Good. And dull. Sharp, good. Dull. Sharp. Very good. Alright, my friend, you can go ahead and open those eyes for me. And that is going to conclude our cranial nerve exam today. Alright, I hope you're feeling okay. I'd like you to make a follow-up appointment at the front desk on your way out. I'd like to see you back in a few weeks for a more in-depth and thorough ear cleaning, okay? Alright, you go home, make sure you hydrate, get real comfy, relax the rest of the day, and make sure you get a good night's sleep. Hey there, I'm Dr. Tingle. See, we have you in for our little sleep exam tonight. Seems you got a little bit of insomnia. Alright, so we're going to take a look at you while you stay overnight tonight. And we're going to do just a little examination on you. And we're going to do some ASMR trigger tests, which have been proven to help people fall asleep. So I'd like you to just relax, just lay there. You don't have to worry about anything. Just going to listen to your heart real quick and your lungs. Alright, so just relax for me. Just breathe normally. Good. Go ahead, take a deep breath in for me. And let it out. Good. Deep breath in again. Out. Good. Deep breath in again. Out. Good. Good. All right. Well, everything sounds good there. I'm just going to take a look at your scalp. Make sure that I'm not seeing any kind of like lumps, bumps, abrasions, things like that. So just relax. Okay. Okay, really not seeing any issues here. Good. All right. That's just the desk. All right. Open up, say, I'm just going to take a quick temp check on you. Good. No problems there. All right, so why don't you tell me a little bit about your sleep habits? What time you go to bed? Okay. Do you use any sleep aids, over-the-counter stuff, or, alcohol, cannabis, drugs, anything like that? No judgment, just need to know for medical purpose. Okay, good. Yeah, a little weed once in a while to help you sleep is not a problem. Make sure you just get you adjusted right here. Okay, so outside the insomnia, is there anything else going on I should know about? All right, good. So we're going to just do a little exam, just a little eye test, look at your ears real quick, make sure everything's working, just a little sensation exam, make sure that, I'm not seeing any kind of signs of, nerve abnormalities or anything like that. All right, real quick. All right, so you just lay there with me real quick. I just want you to follow that light. Just follow the light for me. Good. Keep following. Good. Just gonna cover one eye real quick and swing the light in, out, in, out, in, out, in, out. Good. Cover the other eye real quick. Same thing. In, out, in, out, in, out, in, out, in, out. Good. Okay, so just keep following the light for me again real quick. All right, now I want you to tell me when it goes out and then back in, okay? All right, here we go. Ready? Good. 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 Good job. Good. Okay. Try that one more time, a little farther away. See this light here? All right, same thing. Just follow it. Just follow with your eyes. Don't move your head. Don't move your head. Good. Good. Hello. Good. Alright, I'm just going to take a look inside your eye with my ophthalmoscope real quick. I just have to get real close for this, so just bear with me. Just look up for me. Good. Down. Good. Left. Right. Okay, good. And the other eye. Same thing. Sorry, lean over. Up. Good. Down. Left. And right. Good. Alrighty. Alright, we're going to finish up those eyes right now. I want you to just tell me how many fingers I'm holding up. Okay, ready? Good. 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 Alright. Have you had any loss of smell or taste recently in the last 6 months? No? Okay, good. Alright, I'm going to take a look inside those ears for you. Alright, just relax. You can close those eyes if you'd like. Just relax. Just gonna take a look inside. Alright, here we go. Okay. Do you have any ear pain? Because that's pretty dirty. I'm gonna go around the other side. Okay, let's take a look at this one. It's about the same thing, pretty dirty, so we're definitely gonna get these cleaned out for you. Okay, so we're gonna get those ears cleaned out for you real quick, and then we're gonna move on to our trigger test, okay? Alright, so you just relax. You can close your eyes. I'm just going to grab some tools and we'll get to cleaning those ears, okay? Alright. Alright, so we're just gonna work on cleaning out these ears here. You let me know if there's any pain at all during this. Just push that out a little bit. Just get that brushed out a little bit more here. Let's take a look. Take a look. Okay. Yeah, that's much better. Good. Let's get that other one. Actually, give me 1 second. We're just gonna brush off. Alright, so those ears are all cleaned out for you. We're going to move on to a sensation test and then some trigger tests, okay? Alright, so for the sensation test, I'm going to have you close your eyes, and I'm going to touch you with either the soft brush or the dull acupressure tool. Alright, so dull or soft. Alrighty? Alright, here we go. And soft, good. Dull. Soft. Dull, good. Soft. Dull. Soft. Soft, good. And dull, good. Dull, good. Soft. Soft. Alrighty. Go ahead and open your eyes for me. Okay, so we're going to begin our trigger test with a little toxin massage. So I'm just going to do this on your upper chest area and around your temples. It will not hurt. It's going to feel very, very gentle. You're just going to feel light taps. And people find not only the sensation very ASMR inducing, but also the tap sound. So you can just relax. You can close your eyes if you'd like. And just go. And this is just to help you relax. And you can fall asleep anytime, as you will be spending the night anyway. Okay. And do a little face brushing. People find this very, very relaxing. And people respond to different stimuli, different triggers. Some people like visual, some people like audible, some people like both. It's really what your preference is. Good, good, good. Okay. Are you feeling again sleepy? Okay. So we're going to end this exam with a guaranteed sleep inducer. So we're going to give you a nice ear massage and acupressure. So it's like an ear massage, acupressure, and a very, very intense and tingly ASMR trigger. And you should just fall right to sleep during this, okay? Alright, so just relax, close your eyes, and we'll see you in the